Good morning, everyone. I'm Tran Bowie. Thank you so much for watching this morning. For some people, the coronavirus quarantine seems like a huge inconvenience, but there are many workers who are on the front lines risking their lives every day. And for that, we are so grateful. I feel like we can't say thank you enough. But this morning, joining me is Jon Paul Croom, who is the president of Wellstar North Fulton Hospital. Jon Paul, I know that you are so swamped at this time, so for you to join us this morning, thank you so much for doing that. Let me just start by saying, how are you holding up?
We're doing all right. We've been doing this for several weeks now. I believe our incident command center has been set up for almost 10 weeks. So we've kind of fallen into a new normal, but we certainly are swamped. It's very busy, much busier than I've been at any time in my career, for sure.
Well, you have 11 hospitals, and you're in charge of this one, but I know that you're seeing what's going on at the other ones. Talk to me about how the hospitals are looking right now. Who's working? What is happening within the walls of the hospital? Can you kind of give us a picture?
Sure. So, our 11 hospitals, we spread everywhere from here on the north side of Atlanta, all the way through Atlanta, around the perimeter, down as far as LaGrange and Spalding counties. So, and I say that because everybody's experiencing a little bit different amount of impact from COVID, but we are all doing very similar things. We have our incident command center set up. We are watching several times a day on where we need to staff, watching the number of patients that are coming in. Making sure that our leaders and our team members get breaks as needed. It's a 24/7 operation. We run all the time, and we just have to continue to make sure that everybody gets a mental health break and a physical health break. But I will say that all of our professionals are just that. They are fantastic. They train for this. They love what they do, and they just do a great job coming in every day.
Well, I know that you also have a family, and I'm not sure how old your children are. I believe they're young children. So this has to be even more challenging for you because you're trying to balance both.
Yeah. Well, I think for me, we have three children, 7, 11, and 14. And
Wow.
I think most of that credit, 95% of it goes to my wife. She is a saint right now for not only being a mother, staying with the kids for every day, but also being a school teacher.
Wow. Yeah.
During this time. So, and I know so many parents are doing this right now, and I think I think out of this we have such a new high appreciation for our teachers and what they do. But yeah, it's been a challenge. It's also been more time with the family. But we try to find the positives out of this as well.
Well, we thank you so much for doing that. And I know the big concern we keep seeing is over the protective equipment. There are so many groups out there either collecting for masks or actually making masks as well. So tell me, how are you okay right now? Do you have enough?
Yeah, so both Wellstar has done very well at supply that we needed, especially with masks and gowns and gloves. I think everybody, when this first started, there was a run on supplies, and it took a while to catch up. But we are in good shape.
Okay.
We also, are very thankful. Working with the state government has been terrific about working with us and making sure that not just our health system, but all health systems are starting to get more and more supplies. But we do, as you mentioned, there are a lot of people out there that are making masks. I think a lot of that was happening initially. I think we saw a lot of that on the news with Albany and Phoebe Putney. I certainly think that there was a recent CDC guideline that came out just talking about wearing cloth masks, homemade masks in the community. Is a good practice. So we certainly support community members that do that. A lot of it just keeps you from touching your face and remembering you have something there. But yes, yeah, we are seeing a lot
I
of
was asked, I did want to know about the effectiveness of those masks that people are making. Are you able to use them as well, or you have to stick with the approved masks?
So we have stayed with the manufactured
Mhm.
mask just because we do have an adequate supply of those. We're not at the point of needing to use the cloth mask in the hospital, but we certainly do encourage people in the community that don't have manufactured masks to certainly to embrace that.
Okay, great. Well, that's good to know.
Yeah,
And we always talk about the doctors and nurses who are really on the front lines, the ones that we see all the time, the ones we think about through this whole process.
yeah,
But sometimes we forget about the people behind the scenes. Like you still have people who are probably, stocking the shelves and
right,
making sure that the hospital is clean. And then I don't even know who else is working there behind the
yeah.
scenes that we never hear about. So do you mind talking about them?
Sure. Yeah. So, a hospital, if I were to describe what a hospital is, it truly is about 40 small businesses all under one roof, and they all work together. And we think a lot of times about doctors and nurses, but we have housekeepers and radiology techs and phlebotomists and people that make the food, and people that deliver the supplies. And all of these people are so essential, and have to show up every day, or the system just doesn't work. And we do have just talking about the housekeepers, they are terrific. A lot of them travel long distances to be here, and they come in every day and they don all the personal protective equipment and go in those rooms and clean rooms and disinfect. And so, yeah, we're thankful for every piece of that, way beyond just our great doctors and nurses.
Yeah. So are you able to give us, I know the numbers are changing all the time. Are you able to, oops, there you are. And I,
Oh,
yeah, there you are magically appearing. An idea of what the numbers are like right now. Are you seeing a slowdown, or more people coming in, more people coming out? Just to kind of give us an idea and maybe give us some hope.
yeah. So, a couple things on that. I think generally, most hospitals, over the past week or so have seen kind of a flat number, which means that we're discharging about as many as that we're admitting.
Okay.
We have seen some, great stories about patients that have recovered, that have been through ICU, have been on intubation, have come off of that, and have walked out of the hospital. So there are some wonderful stories of people recovering. We really listen to the CDC every day about what their estimates are of when, they're still predicting a surge. So we kind of depend on what they think is going to happen in Georgia, and we try to prepare based on that.
Okay.
But there truly are a lot of wonderful stories of people recovering, and our doctors and nurses are taking the latest information they have for treatment and applying that every day.
Okay, and that's a good place for us to look as well. I like to go on the CDC page as well and look,
Mhm.
get the numbers. There's a question from Lynn McDonald. Are these essential workers tested regularly?
So we do have a policy within Wellstar. There are certain criteria for testing. Certainly, if someone exhibits symptoms, and I think as everybody's seen in the news, temperature is usually one of those symptoms. We do have a plan in place, and we have clinics set up to test those employees, as soon as they start exhibiting symptoms. And if they're fine, there's a process on how they come back to work. If not, they're self-quarantining.
Okay.
Also, it's one of these things that we realize that if a team member contracts COVID-19, they just as well could have contracted it, walking through the Publix or the
Right.
Target. So we're aware of that too, and we encourage anybody that's not feeling well or has symptoms prior to coming into work to let us know. And we did within Wellstar set up a COVID employee hotline for people to call, and there's a whole list of steps for them to walk through.
Oh, that's wonderful. Okay, and speaking of the employees, we have to remember that it has to be so emotional for us sitting at home we're complaining about minor things, but the workers are there and it has to take an emotional toll. So what kind of support system is in place? Like, are they able to receive counseling, through the workplace because of this?
Sure. Yeah. So we have several things in place. I mean, one is the hotline number. That's kind of a starting place, and that's manned 24/7 for someone to speak with the team member. We also have a toolkit, both for their mental health and physical health, to kind of walk them through that. Every hospital also has chaplaincy services. So we have a full-time chaplain here that has done a great job of touching base with those team members, not just from spiritual needs, but also from that psychological need as well. And we have, and I know I had a list of things here, but that was those are the main things that we are doing. But certainly we have lots of communication set up. It's been interesting during this time. We've really moved from a more face-to-face communication with large groups of our team members, which is just typically what a hospital does a lot. Now we've really moved to virtual. We do a lot of virtual town halls, a lot of videos that we send out, just giving updates on new information, and our communication is very important. We try to keep that as flat as possible.
Yeah, I'm really just fascinated by all these businesses that are coming up with creative ways to still stay in contact. So we have another question from Anastasia. Why do you wait for employees to show symptoms since there are so many infected and contagious without showing symptoms? And yeah, I'm going to let you answer that. I'm not sure if you addressed that
Sure.
earlier.
Sure, that's a great question. So, what and this is just from the news. I've seen, some other countries that are been a little bit ahead of the United States, such as China, who started, well ahead of us, was able to develop test kits, and they've gotten much, much faster, and the number of kits have increased. I will say that, I don't know that any hospitals are quite at the point of having unlimited test kits. Eventually, I think, and this is just me making a speculation, it's not from Wellstar, but I think in the future we'll probably have enough test kits to test large numbers of the public in addition to those that are working here. So what we try to do is with the test kits that we have, we really try to focus on those people that are starting to be symptomatic and show symptoms. One of the things we did several weeks ago is we began a process of making sure all of our team members started wearing masks, and not just with interactions with patients, but also with each other. Because I think you're the person to ask that question. It's a good one. Because we do know and are learning that people are asymptomatic, and although we definitely want to protect our patients and they're number one, we have to protect each other as well, because we do have a limited workforce with certain skill sets that we could not afford to lose for long periods of time. But I think as the United States begins to ramp up and create more and more tests, I think we'll see more of that within our hospitals and communities.
Yeah, I am seeing more reports of more testing sites popping up, so that is good
That's
news.
right.
So
Yeah.
for us at home, the shelter in place was just extended,
Yes.
and we now know wash our hands, cover our face, protect ourselves. So the 6 feet rule. Can we talk about this?
Sure.
How accurate and effective? Because sometimes I'll see, people out, and I mean, I don't have my tape measure out, so I'm not really sure how
Right.
far apart they are.
Right.
But tell me about that. Is that enough right now?
So the 6 foot rule is in place, primarily because we know that COVID-19 is spread most often through droplets,
Mhm.
and that means when you're speaking with somebody, even when you're speaking, there are droplets that come out of your mouth when you're talking, or certainly if you sneeze,
Right.
that can land on somebody else and potentially infect them. Also, we believe that the largest reason for COVID transmission is these droplets get on, hard surfaces, stay for, several hours or days, depending on what report you see. You touch that surface, don't wash your hands, and then, touch your face, your mouth, nose, or eyes. And, we know that that is probably the greatest reason for spread. But the 6 foot rule is important. If you're not wearing a mask and you're not with your family, it is important, especially in those circumstances.
Okay.
I think, yeah, okay.
It's still good then. So
It's still good. Yeah, it's still good. And I know there's websites out there that we've looked at that have tracked cell phone data, and you can see areas that are doing great with social distancing. I believe this part of Atlanta is one of those areas that's done much better than other parts
okay.
of Georgia. But what we need is really just consistency across the United States with this.
Absolutely. Well, I'm glad to hear Fulton County has a good report card on this.
Yeah.
Are we at the point yet where you're thinking about makeshift hospitals like in New York City?
So we do have the planning in place,
Okay.
and that goes a lot with our work with the CDC and their guidelines and statistics on when they think the surge will occur. We want to be prepared for that, and we have had the fortune here in Atlanta of watching places like New York City and what they've done and learn what worked for them and what didn't work. But we do have those plans in place. So if we get to that point, we would be able to have tent structures in place to focus on those patients coming in addition to the additional areas in our hospital that we've been able to expand. I think one important thing to remember with hospitals right now is we're not doing elective procedures. There's a lot of normal things that people come to hospitals for that they're not coming for now, such as routine radiology exams like mammography exams. So we have a lot of availability right now and space within the hospital to expand to take care of these patients first before we would go to the tents. But we do have that plan in place should we get to that point.
Okay, and that's a good point that you made, because several of, there are minor doctor's appointments, but a lot of ours have been canceled or postponed. And so if people had questions on whether their appointment or procedure was serious enough to come into the hospital, how do they check? They just call you, or are you calling people to let them know?
So for our clinics, we did cancel several clinics for certain people. We really try to make a determination, is their visit essential or non-essential? Obviously the patient's part of that decision as well. We try to make sure that, if it's just a routine visit, we have to determine is, will that patient, come to harm if they don't get to see their doctor in the next 4 weeks? Do they need a refill on medication? Are there things we can do remotely? Certainly, certain types of procedures, if they have to have that done, and I think, cancer oncology is a big piece of that as well. You can't wait a long time. So we are taking all of these case by case and trying to work with the patients and the physicians to make the best decisions for them at this time.
Yeah, and I know that must be hard because like some of the appointments that we had were pushed back to April or May, and now they're calling again to say, hey, we're not really sure, just be on standby. So we're getting a lot of comments and questions about how we can help. That's a big, that's big right now. We know that, we get to stay home. We have the privilege of staying home. Those of you on the front lines don't have that. So what do you need from us right now?
So I'll just mention a few things that have occurred. We've had a huge outpouring of support from the community, and they've reached out and done things like buy food for the frontline workers, food for the support staff. We have had donation of supplies that have occurred, and there's been great we have. Wellstar is a not-for-profit company, and we do have on our webpage set up a way to donate financially as well to help people during this COVID crisis. I think it's important to we certainly support our local businesses. we want to make sure that, that we're thinking about those people that are really in need right now as well. And, encourage, we certainly appreciate the support at the hospital, but also, encourage people to kind of reach out to local areas of people that, are really in need at this time and helping them as well.
Oh, I love that heart. So Kara is saying the Wellstar Foundation. Could you
Yep.
tell us a little bit more about funds can be designated to the COVID-19 response?
That's right. Yeah. So if you go to I think it's the wellstar.org webpage,
Okay.
you'll see a link on that webpage for the foundation and how you can give and be a part of that. And there's a link there that will take you directly to a COVID-19 give page, and you can enter in there. So.
Okay, and we'll put that information on
Okay.
as well. And Edward Class is saying, thank you for everything. Wellstar is a blessing to our community. Be well. And so that's such, I think that's a message from all of us. I know that you are working long hours and trying to manage a lot and trying to make sure that we are safe. So thank you so much for doing that. And please thank your entire staff at all 11 hospitals, that we do really appreciate it. And a final message for people out there. As we're going through this, the emotional, the physical, whatever that you feel we need to hear right now.
Yeah. Our most important message is to stay healthy, stay safe, and please, continue your social distancing. It really does help. We do a great job of taking care of patients. It's just really hard if we have to take care of all the patients at the same time. And that's really what social distancing is about. And we appreciate, the sacrifices that all of you are making right now. And, we really do want us all to get through this very soon together. So we just ask that you stay healthy and take care of each other and take advantage of this time with your families.
Oh, thank you. That was beautiful. So for all of us out there, we need to do our part. Thank you so much for joining us. Have a great day. Please get some rest. I
will. I will try.
All right. Bye-bye.
Great. Thank you, Tran. Bye-bye.